Hi everyone, welcome to my YouTube channel, My Health and Me by Fun. Please like, subscribe and share. Blood is essential for life. It carries oxygen and nutrients throughout the body, fights infections, and helps with healing. Sometimes people lose blood due to injuries, surgeries, or illnesses. In such situations, a blood transfusion can be a life-saving procedure. Blood transfusion is the process of transferring blood or blood components from one person, the donor, to another, the recipient. This medical procedure helps replenish blood volume, replace lost blood cells, and improve the body's ability to clot. Blood donation, on the other hand, is the voluntary act of giving blood, knowing it will be used to save lives. Blood donation forms the foundation of safe and effective blood transfusions. Without generous individuals willing to donate, hospitals would face critical shortages, impacting countless patients in need. Donating blood is a simple yet profound act of kindness. It is a testament to the inherent human spirit of compassion and the desire to help others in need. Blood is not a uniform fluid. It comprises different components, each serving a specific purpose. This is why there are various types of blood transfusions, each tailored to address specific medical needs. Whole blood transfusions, involving all blood components, are typically used for significant blood loss, such as in trauma cases. Red blood cell transfusions are the most common type. They are used to treat conditions like anemia, where the body does not have enough red blood cells to carry oxygen effectively. Platelet transfusions help control bleeding in patients with low platelet counts, often seen in cancer treatments or certain blood disorders. Plasma, the liquid part of blood, contains clotting factors and is used in transfusions to treat bleeding disorders or liver diseases. Each type of blood transfusion plays a specific role in restoring a patient's health and well-being. The choice of which type of transfusion to administer depends on the patient's condition and the underlying reason for the transfusion. While blood donation is open to most people, certain criteria must be met to ensure both the donor's and the recipient's safety. Donors are typically aged 17 to 65 years, depending on local regulations. Donors should be in good health and free from any serious illnesses that could affect blood quality. Most organizations require that blood donors weigh at least 110 pounds, 50 kilograms. Donors can give whole blood every 56 days, platelets every 7 days, and plasma every 28 days. The process of donating blood includes registration, where donors provide their personal information and medical history. A brief health screening is done to ensure the donor is fit to give blood. The donor's blood is then collected into a sterile bag, usually taking about 8 to 10 minutes, and after donation, the donor is given refreshments and asked to rest briefly. Safety measures are put in place for blood donation and transfusion. All donated blood is rigorously tested for infectious diseases to ensure its safety. Before transfusion, blood is cross-matched to ensure compatibility and reduce the risk of transfusion reactions. Blood donation centers are regulated by health authorities to ensure the safety of both donors and recipients. Blood types are classified into 4 main groups: A, B, AB, and O. Each group can be positive or negative, depending on the presence of the Rh factor. For example, someone with A positive blood can receive A positive, A negative, O positive, and O negative blood. However, a person with O negative blood can only receive O negative blood. Blood transfusions require that the blood of the donor and the recipient be compatible. The major blood types are A, B, AB, and O, and they are classified based on the presence or absence of antigens on red blood cells. Type A has A antigens on red blood cells. Type B has B antigens on red blood cells. Type AB has both A and B antigens, universal plasma donor. Type O has no A or B antigens, universal red cell donor. Also, the Rh factor, positive or negative, must match between the donor and recipient. A mismatch can lead to serious complications, including immune reactions. How blood compatibility works. O-negative blood is known as the universal donor for red blood cells because it lacks A, B, and Rh antigens. AB positive blood is the universal recipient, meaning they can receive red blood from any donor. In plasma transfusions, the compatibility is based on blood type, but AB is the universal plasma donor. Knowing these compatibilities helps prevent adverse reactions during transfusions. Blood transfusions, while life-saving, do come with certain risks. These can include allergic reactions to components of the donated blood. A mild fever may occur as the body reacts to the transfused blood. Multiple transfusions can lead to excess iron in the body, which can damage organs. Though rare, blood transfusions can carry the risk of transmitting infections like HIV, hepatitis, or bacterial contamination. To minimize these risks, blood is rigorously tested and matched to the recipient's blood type. Additionally, healthcare providers monitor patients closely during and after the transfusion to address any adverse reactions promptly. It is important to follow all medical guidelines to ensure the safety of blood transfusions. Regular blood donation is vital for maintaining an adequate blood supply. Blood has a limited shelf life, so there is a constant need for fresh donations. Donating blood not only helps those in need, but also has health benefits for the donor. It can improve heart health and iron levels. Plus, it is a way to make a significant impact on your community. By donating regularly, you ensure that blood is available when it is needed most, saving countless lives. Some studies suggest that regular blood donation may have health benefits, such as reducing the risk of certain diseases like hemochromatosis, iron overload,